Well, we were fortunate enough to be able to visit with a trainer that is in the cutting industry, known very well. Mr. Dirk Blakesley from Augusta has given some time to us today to visit about dentistry and maybe some of the things that we've noticed both pre-ride and post-ride. Dirk, based on the pre-ride and the post-rides from the few dentals that we've done, could you maybe tell us what the advantages or the disadvantages of this type of dentistry, being comprehensive dentistry, that you feel are versus the old technique of just floating?
The disadvantages as a trainer, I feel, to riding a horse that has not had correct dental work is that horse can tend to be resentful. Anytime you take a hold of his face with a bridle, he can become stiff and rigid, which makes the horse hard to move, and you may think that horse is bad-minded when in fact he is just in pain anytime you go to taking a hold of his mouth. The advantages are if that horse feels good and does not have sores in his mouth from sharp teeth, then when you ask him to move or go somewhere, he is much more willing and much more trainable, which is much more appealing to me as a trainer because nobody likes to have to fight with one. Let's look at a couple horses before the dental work, and then we'll look at a couple of them after the dental work. This is a video of before the dental work was done on this horse, and some of the things I feel in him that makes me believe he needs his teeth worked on is the flipping of the head and opening the mouth right there, which after the dental work will help take care of much of that.
Here's what we found on the little bay horse during the dental procedure. What we find is that we have some retained caps. You can see the sharp point there as we're entering the mouth. You can also visualize some of the lacerations upon the cheek here. As you're looking at that, you can appreciate that it's mainly lacerated over the back 2 to 3 cheek teeth. As we move back out, then we find this cap that is the speculum's hooked over, how loose it is, and the laceration is on the tongue, which you cannot visualize. Also, we found a fractured cap on the lower right. You can see here only the back part of that baby tooth is left. The tongue was also lacerated. As you're looking across to the left, there is a large lesion upon the cheek. I think you can appreciate how sharp the front 2 baby teeth or caps are that are left in this horse's mouth.
This colt in the after shot here is more supple and moves his feet much freer and is much more attentive toward a cow than he was before the dental. Noticed quite a difference in this horse. This is a before shot of a 3-year-old C.D. Alina. As you can see in this video, he's trying to stick his nose up in the air and he's opening his mouth up. This is before the dental work was done. And he wants to be more stiff. His feet are kind of stuck to the ground. He's not rocking back on his hindquarters and moving his front end like he should. And I believe a lot of this goes along with the dental work where when he lifts his nose like that, he is unable to move his front end properly.
One of the first things we noticed on the gray horse was the lacerations over the bit area, especially at the front. We also found these large lesions at the back over the last cheek tooth. I think you can appreciate how necrotic and ulcerated this lesion is on both sides. Next to the second and third cheek teeth, we also had several lesions. As we move to the tongue on this horse, I want you to notice the ulcerative, brown, necrotic looking tissue upon the edge of the tongue. I think you can appreciate why if you put a bit in this horse's mouth and move this tongue up and back, how it would contact these teeth and produce severe lesions. This is the right side of this horse's mouth. We had a few lesions upon the cheek, although they were not nearly so significant as the left or the tongue.
After shot, this colt here is real relaxed. He's quiet to the bridle. His ears are up on a cow, and he's letting me handle him without being real resentful. This horse had his teeth done approximately 2.5 weeks ago. And right here I'm working on, I want him to bend soft right and left and to bring his nose in and down whenever I ask him to back up, instead of sticking his nose up and out or being stiff to the right or left. Felt some big changes in this colt from the before and after. The little blaze-faced sawhorse here is a 2-year-old that has approximately 60 to 90 days of riding. He had extremely bad teeth, several sores in his mouth. He would get rather nervous when we would ride him and flip his nose. As you can see now, this little horse is really quiet, gives his head real well. We use him all day long, and he's just real good to ride now and never have any trouble wrestling around with his head.
Again, I'm Dr. Hickman. I'd like to say thank you to each and every one of the people that made it possible for us to be a part of this thing. And perhaps through today, you've gained a little better understanding of how you and your mount can work together and how dental anatomy is different and unique within the horse. Why it's important for a dental exam to be done properly and thoroughly, as well as what the difference between floating and true comprehensive dentistry is. How tight the situation is at the back of the mouth, how important it is that we not disturb the soft tissue or produce any more trauma than necessary. And through some of the pre-rides, post-rides, and dental procedures, hopefully a few other performance-related problems that we see, and how those then in turn affect the behavior of your horse. So no matter what discipline you ride under, no matter what your level of riding is, hopefully each and every one of you gained a little bit of understanding about how you and your horse can have a better, longer lasting relationship.